friends, welcome back to Alpha Physiopelvic Care, all things pelvic health. My name is Diastasis and I'm pelvic floor physiotherapist here sharing in my channel all things pelvic health. I'm filming this video in my house just for a change of the environment. Today I would like to answer the most common question that I get as a pelvic floor physiotherapist, both from people in person, both from people who are not related to healthcare, just people in general, as well as questions I get online in my social media. Why do I need a post-pregnancy check by pelvic floor physio? And usually the conversation starts or continues like this. My doctor checks me after post-birth, usually 6 weeks. He or she clears me out and I'm ready to go and to do my things. So what is the difference? Why would I need to come also for pelvic floor physiotherapy assessment? And here I am to clarify this question for you. Number one, there is a substantial difference between Ob-gyn assessment and pelvic floor physiotherapy assessment. Usually the doctor will check the scars, if you had any, to have check of your pelvic organ position. It can be just a manual visual check, it can be checked with ultrasound. They will check if uterus is back to its normal shape and size, if the lining of the uterus is okay, if the generally C-section scar is healing okay, there is no signs of infection, ask you a couple of questions, are you in a lot of pain, and so on, and that would be basically it. This is at least how I get reported the Ob-gyn check by my clients. Now, what does pelvic floor physiotherapy does? And before we continue, I would like to note that we are not competitors with Ob-gyns, or we are not replacing Ob-gyns. We are in the same team, and it's very important to work as a team. I really appreciate all the doctors that are sending me clients for checkup, because also the checkup that is done by pelvic floor physio takes substantial amount of time, and quite often gynecologists don't possess that substantial amount of time that needs to be there in place, especially if there are more questions or issues in regards with the musculoskeletal part of the things. But let's start from the beginning. Things I check as a pelvic floor physiotherapist is I do internal examination, vaginal, whether it was C-section or vaginal birth. And why am I doing it? First of all, to see what is the strength of your muscle, how well they can contract, how correctly you do the contractions, because many women have heard by now Kegel exercises, and they probably have even done them before birth or during pregnancy, but quite often they do them incorrectly. So I manually can check if you do your Kegels correctly. Plus, if you also synchronize them with your breathing, because it is very important. Then I also check of the position of your organs in a different position. When you lay down, your organs, your bladder, the back wall of vagina, your rectum, and also your uterus can be slightly pushed back, and it does not give a full picture. If you are standing, then they can drop down, and it can also give me a full picture that maybe you do have a bit of pelvic organ prolapse. This said, pelvic organ prolapse is quite common in women after birth, and a substantial amount of it can be resolved, or it will become at such a small degree that it will not give you any problems. However, keep listening to what I'm going to say next. Through the interview with a woman, I really ask a lot of details. How is the toilet habits? Does she ever leak? Does she ever feel any heavy sensations? How is the walking? Is she in pain? Does she feel any pulling? How is the sexual life going? Is there any pain? Is she afraid to initiate intimacy because she's afraid of pain? There is a lot of education going on. I literally hold my pelvic model and explain to women what is pelvic floor, what is happening with it, and how is the healing timeline on the scars, and that there is nothing wrong that's gonna happen if she will try intimacy, especially if the certain amount of time has passed. Then I definitely teach the ladies who come through very basic pelvic floor exercises. I always give them program of 2, 3, 4 exercises, as much as they tell me that they can dedicate time to, in order for them to do daily. And they already have their pelvic floor rehabilitation, let's say, mini program that can prevent them from developing further issues, not only within certain weeks or months after birth, but years after birth. Time when the menopause will hit them. If they will create the habit of pelvic floor exercises now, after hearing what I have to say about the importance of the pelvic floor, it can create a long-term prevention habit. I do teach my moms how to work with the scars if they had any. So I teach them how to massage scars around vagina, whereas it was natural tear or it was episiotomy, in order to reduce pain, pulling, and probably long-term pain during intercourse. If it is a C-section mom, I show her how to use her hands and massage her C-section. And this is of paramount importance, because I have seen ladies years after years, decades after birth, and their C-section was still giving them symptoms of tightness, of abdominal weakness, of inability to move freely. So yes, I teach my clients in the postpartum check on the first session basic C-section massage techniques. I absolutely and definitely check my clients for diastasis recti, abdominal separation that can happen after birth. This is quite common, injury after birth, and again, sometimes it will close by itself, but I always say we're not gonna sit and wait around. If it's gonna close by itself, maybe it will, maybe it won't. I always give them, again, some exercises, and usually they go in hand together with the pelvic floor exercise. Because first of all, pelvic floor works together with the abdominals and diaphragm, and second of all, we don't want to overwhelm mom with hundreds and hundreds of exercises. 3 exercises to make sure you do them, and to kind of cover the whole area, both pelvic floor and diastasis recti. Postpartum assessment, I also ask the moms what is their general goal of fitness. Do they want to go back to certain fitness? What to look forward when coming back into this fitness? Do they want to go back to running? So what is the timeline? What is the objectives that I want to see before they go back running? So walking fast without leaking any urine, without feeling any heaviness. Sometimes I get them on trampoline and ask them to jump and see if they can feel the pelvic floor contracting, or they completely lose control of it. And if they do lose control of it, they're not ready to run. Simple as that. If the mom wants to go back to the gym, she wants to start lifting weights, I show her techniques where she can engage and pre-engage her pelvic floor in order to avoid that heavy intra-abdominal pressure on the pelvic floor that she might otherwise experience when she will lift heavy weights without knowing how to engage her pelvic floor. Generally, there can be a lot of questions that I will answer for the moms. It can usually be related also to intimacy, when they're allowed to have sex, how to start, what to expect. And quite often, moms are not giving the real picture. Sometimes in the beginning, sex might be painful. First few times, you will take it easy, you will take it slow. It's not gonna be the movie scene. It's gonna be messy and uncomfortable, plenty of lubrication. Things should get better, and what to do if things should not get better. What would be the, let's say, yellow and red flags during intimacy that you should look out for, and go back to your OB-GYN or to your pelvic floor physiotherapist. All in all, quite often moms are concerned also with the economical part of the post-pregnancy assessment. In many countries, the assessment is covered by the governmental health services, and in some, like in Cyprus, are not. For myself, I work in the private sector only. However, my objective is to give the mom as many as possible management tools through the first or maybe first two assessments sessions. So I want to teach people to manage things themselves, and in 95% of cases this is possible. My main job is just to check them for any issues they might have, as I mentioned already: pelvic organ prolapse, weakness in the pelvic floor, objective ability to contract and relax the pelvic floor muscles, and diastasis recti. And then I'm handing in the tools that they can use to manage the condition themselves. So in my opinion, it's not as huge investment, and it can be planned ahead and put in your budget whilst you're actually pregnant. I hope, guys, this video gave you some explanation and it maybe helped you to make up your mind and understand that pelvic floor assessment by physiotherapists should really be a standard care route. And let me know in the comments if you ever experienced pelvic floor assessment, if you went to one or you never heard about it and have no idea what it is. Don't forget to like this video if you enjoyed it, share it with your girlfriends. Let's raise awareness together, and we'll see you back on my channel very, very soon. Bye.